Welcome everyone to another wonderful episode here, Doctors of Podiatry. Just like I promised everyone, today we're actually in our office-based surgical suite. What we're going to be performing today is our multiple procedures. This is going to be a relatively quick case, and I think it's a great case for a lot of reasons. A lot of people suffer from neuromas, an inflammation of the common plantar digital nerve, whether it's in the second, third web spaces. Okay, I put up a video that, earlier this week called Neuromatopia on our YouTube channel, and then on our Facebook fan page, I also put up the MIFAS case about the patient that has a very large neuroma on the third interspace. In respect to the treatments available, the patient already had an excision of the open traditional approach on the right foot, and the patient did not really enjoy the post-procedural, I would say, symptoms after that. And because of that, we're approaching this from a very conservative, standpoint. The purpose of the procedure, our metatarsals, are held together by this really important ligament called the deep transverse intermetatarsal ligament. And the patient's third and fourth metatarsals are really close to each other. So having that space-occupying lesion right in the middle, which is the neuroma, every time that this happens, or any movement that makes this occur, basically imagine that you're hitting your funny bone over and over again. So the purpose of the procedure is to transect, to cut that ligament in order for the metatarsals to basically move away from each other, allowing the nerve to kind of just sit in a little bit more space, right? So without further ado, Sebastian, I'd like for you to just come around here, okay? And you're gonna stand right here, and that's perfect. You can get a little bit closer if you'd like. Again, that would be perfect there. Okay, so again, there's different, treatments. We're also going to inject a little bit of PRP and some ozone. Okay, we've already marked the spot, right? This is the fourth metatarsal. We have the third metatarsal here. The patient has a small neuroma, which we're also going to inject in the second interspace, and after we're done with this procedure, then we'll also inject a little bit of both. Again, the PRP and the ozone to both. So, without further ado, let's go ahead and, if you feel any discomfort, patient, please let me know, okay? How you doing there? Okay, good. So we make a little stab like that. Okay. And this ligament is actually on the bottom, okay? And what we're trying to do is basically create a little portal, right? So we can actually identify it, and there it is right there. How do I know? Because I can actually, I'll show you guys, I can actually, it's that strong where I can actually, believe it or not, I can actually pick up the foot, right? That's how strong it is. So we have identified the ligament. And again, I'm just creating this tiny little portal here next to the bone, which is right here. Okay. So now very carefully, How are you doing, patient?
Okay.
So what I'm doing is I'm looking for it, and we should feel right there. I don't know, usually the patient can actually feel a crunchy feeling, and I feel it here. The name of the game is okay, there's one little strand. Now we're just gonna double check again.
You all right, Miss Sherry?
I am.
Okay. It's really important that we, because it's such a strong ligament, that we release the entire I can actually feel that the two metatarsals already have given, right, so to speak. They have separated. That tightness, right? You see how loose it is now, but from before. And I'm using this finger, right, to feel the bottom. I can feel this instrument on the bottom, and it's very important because, again, the nerve is underneath this ligament. In order to get to the nerve from the top, right, the open traditional, you have to transect that ligament to get underneath. There's one tiny little strand there. Very important to stay next to the bone, right? Very, very important. And it's all about, if people are wondering, well, Dr. Wagner, you really can't see anything. It's all about tactile. It's all about the feel and knowing the anatomy, right? Very, very important. How's the patient doing, Aisha?
She's perfect.
Excellent. Okay. I think we're almost done here. And sometimes you can actually even see the toes basically just move away from each other a little bit, right? We're just gonna give it one little last. Am I blocking your view there, Sebastian? Mm-hmm. Sure? Mm-hmm. So just like that. So what we just basically did was transect that ligament, right? That really important ligament called the deep transverse. And now what we're gonna go ahead and do is, well, do we have the PRP, please? Fix my glasses there. Thank you. This is, this is a phenomenal. This is what fat looks like, if anyone is wondering.
How much ozone?
We can do that after, actually. You know, and you know, very important. So what we're gonna go ahead and do is grab our little PRP. We're gonna go ahead and inject a second. Okay. You may feel a little bit of discomfort, okay, patient? Any discomfort?
No.
Good. How about now? So we'll go ahead and put a little bit here, a little bit proximal. Go ahead and also here, a little bit here. And there as well. Voila. We're essentially done with the procedure. The only thing that's left is the ozone, which I'm gonna go ahead and inject after we close up. I'm gonna put one tiny little stitch here, and we're done with the procedure. Again, what did we do today? We did a release of a very important ligament called the deep transverse intermetatarsal ligament that holds the metatarsals together. There's a neuroma, an inflammation of the third, right, 1 to 3rd nerve, the common plantar digital nerve. And what we're gonna go ahead and do is, the goal of the procedure is to open up that space, right? The nerve is kind of like, and now it's able to kind of rest a little bit more comfortably, thus eliminating what she's been experiencing, the symptoms of, excruciating pain. She's extremely active, loves to run, loves to, just go out and about, hike, this and that. So again, we've chosen this procedure for a lot of reasons. I hope everyone has enjoyed this video. I will continue to slowly post other videos as well. So like always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Have a wonderful day, everyone.